If you turned 65 this year, or you're getting close to it, there are 5 bills sitting in your mailbox right now that the government has already agreed you might not have to pay in full. Not a coupon, not 10% off the top. In some cases, the entire balance. Forgiven, because a law already exists that says so. And here's the part that should bother you. Nobody who benefits from you paying that bill has any reason to be the one who tells you that you can stop. The hospital won't call you. The county tax office won't send you a letter. The pharmacy won't mention it at the counter. They simply wait quietly because most people never think to ask, and the money keeps flowing in exactly like it always has. So stick with me because by the end of this video, you'll know exactly which 5 programs apply to you in 2026, exactly what the numbers are, and exactly what to say when you make the call. And don't leave early, because the last one can be worth more every single month than the other 4 put together. Let's start with the one that affects almost every senior on Medicare, your prescription drug costs. As of 2026, there's now a hard federal cap on what you can be charged out of pocket for covered medications in a single year, and that number is $2,100. Once your spending on covered drugs hits that mark, your plan is required by law to cover 100% of the cost of every covered prescription for the rest of the year, $0 for everything. Think about what that replaces. Just a couple of years ago, a senior taking a single expensive medication, something for a heart condition or a cancer treatment, could watch a pharmacy bill climb past $8,000 in 1 year with no ceiling in sight. That open-ended exposure is gone. The law drew a hard line and said no further. There's a second piece almost nobody uses. If a big prescription bill would normally hit you all at once early in the year, you can ask your plan to enroll you in what's called the Medicare Prescription Payment Plan. Instead of one large bill, your out-of-pocket costs get spread evenly across the months, interest-free. Picture a man in his late 60s managing type 2 diabetes and high cholesterol, filling 4 prescriptions a month. In January, before this cap applied, refilling everything at once used to cost him close to $900 in a single trip to the pharmacy. In 2026, once his yearly total touches that $2,100 ceiling, often by summer for someone on multiple maintenance drugs, every refill after that is free for the rest of the year. He never had to file anything for the cap itself. It's automatic. But almost nobody at his pharmacy ever explained the payment smoothing option that could have kept his January bill from spiking in the first place. That part, you have to ask for. This next one surprises people every time because most seniors have never heard the name of the program, even though it might apply to them right now. It's called the Qualified Medicare Beneficiary Program, QMB for short. If your monthly income falls under roughly $1,350 as an individual, or around $1,824 for a married couple. In most states, you likely qualify, and when you're enrolled, 2 things happen at once. First, the state pays your Medicare Part B premium for you every month, straight out of your Social Security check being reduced. Second, and this is the part that stuns people, it becomes against federal law for any doctor, hospital, or pharmacy to bill you for the deductibles, copays, or coinsurance that Medicare would normally leave on your shoulders, against the law. If a provider sends you that bill anyway, they've made an error or worse, and you do not owe it. Enrollment in this program also quietly unlocks something else: automatic qualification for extra help, which lowers your prescription costs even further than the standard cap we just covered. Here's where this gets real. Imagine a widow living mostly on a Social Security check just under $1,300 a month. She assumes, like most people do, that a government benefit this generous must be for someone poorer than her, so she never checks. Meanwhile, she's been quietly paying $20 and $30 copays every time she sees her primary doctor, money she was never legally required to hand over. If she qualified and simply didn't know it, she can apply through her state Medicaid office, the same office that runs Medicaid, even though QMB is a Medicare benefit. And if she finds old bills she paid by mistake after she was already approved, she has the right to request that money back. Here's one most people have never connected to their own hospital stay. Most hospitals in the United States operate as nonprofits, which means they pay no federal income tax. In exchange for that enormous benefit, federal law requires every one of them to run a financial assistance program, sometimes called charity care, for patients whose income falls below a threshold the hospital sets, which by law has to be published and reasonably generous. This isn't a favor. It's the price of their tax exemption. And it applies whether or not you have insurance, because even with Medicare, a senior can walk away from a hospital stay owing thousands of dollars that coverage simply didn't touch. The catch, and it's the same catch running through almost every program on this list. The hospital is not required to offer this to you automatically. You have to ask for it by name. Picture a woman in her early 70s who spends 4 days in the hospital after a fall and comes home to a bill for $11,000 that Medicare didn't fully cover. She assumes there's no way around it, so she starts setting up a payment plan and quietly cutting back on groceries to keep up with it. What she doesn't know is that if she'd called the billing department and said the words, "I'd like to apply for your financial assistance program," the hospital would have been required by the terms of its own tax exemption to review her income and, in many cases, forgive most or all of that bill. The application takes 15 minutes. The bill sitting on her table might not have been hers to pay at all. For homeowners, this is often the single largest recurring bill of the year, and most seniors have never heard of the option that goes furthest. You may already know some states offer a senior exemption or a tax freeze. This is different, and it's more powerful for anyone who's genuinely stretched. In many states, once you reach a certain age, usually 65, you can apply through your county to defer your property tax entirely, not reduce it, defer it. The state pays the bill on your behalf year after year and simply records what it paid as a lien against the home, to be settled later, typically when the house is sold or passes on, often at a modest interest rate. Think about a retired couple living on 2 Social Security checks in a house they paid off 2 decades ago, now facing a property tax bill of $4,000 a year that keeps climbing. That's real money coming out of a fixed income for a house they already own outright. If they applied for deferral, that bill simply stops landing on them for as long as they live there. It's never automatic. You apply through your county assessor's or treasurer's office. But the paperwork is usually a single form. And now the one I asked you to wait for, because it isn't a bill you stop paying, it's a monthly check the government owes you that most eligible people never file for. If you served during a recognized wartime period, or you're the surviving spouse of someone who did, there's a benefit from the Department of Veterans Affairs called Aid and Attendance. In 2026, a single veteran can receive up to roughly $2,400 a month. A married veteran can receive up to roughly $2,800 a month. And a surviving spouse can receive up to roughly $1,500 a month. Every dollar of it is tax-free, and it arrives for life. You don't need a combat injury. You don't need a service-connected disability. You only need to have served during a wartime period, meet a net worth limit that sits around $163,000, not counting your home B, and show that you need help with the ordinary tasks of daily living, whether that's at home, in assisted living, or in a nursing facility. I think about the widows most of all. A woman whose husband served decades ago, now paying out of her own thin savings for someone to help her bathe and cook, with no idea the VA owes her over $1,000 a month for exactly that kind of help because of what her husband did in his 20s. That check would change her month completely, and it's been sitting there unclaimed the entire time she didn't know to ask. Look at what all 5 of these actually have in common. Not one of them switches on by itself. The pharmacy won't remind you your costs are capped. The Medicare provider breaking the law by billing you won't confess it. The hospital won't volunteer the application. The county won't offer to pause your tax bill, and the VA won't call a widow to tell her she's owed money. None of this is a trick. It's silence. The system was built with these protections in it, and it's simply counting on most people never asking. So this week, pick the one that fits your life and make one phone call. If you're on a tight income, ask your state Medicaid office about QMB. If you're holding a hospital bill, say the words Financial Assistance Program before you pay a cent. If your property tax is squeezing you, call your county about deferral. And if you or your spouse ever served in wartime, make the call about aid and attendance. It's the one call on this list most likely to be worth thousands of dollars a year for the rest of your life. You don't have to chase all 5 today. You only have to open one door because behind it is money that was already meant to be yours.